Our group theory presentation is based on internal family systems therapy. This is a modality that's somewhat recent and has offered a lot of change for a lot of people. We were very excited to see how it could be applied to the group setting as it's typically seen in individual counseling. Throughout this presentation, we're going to introduce the basic concepts of the theory. We're going to bring an understanding of how internal family systems would conceptualize someone like Joe and the issues they experience. And we're also going to dig into how we would apply this theory to our in person work with Joe.
Let's start with the basics of IFS. Richard Schwartz uh, invented, in air quotes, came up with it in the late 80s. And the concept is that everyone is born with parts and a self. The self is meant to lead, and the parts assist the self in leading and making choices for the person's life. There are no bad parts. The parts are all born joyful. Um, and when the person is young and they experience traumas, these parts can feel very hurt or angry or vulnerable, and they get stuck in extreme roles, which is called being burdened. And when they're in these extreme roles, they can have very extreme emotions. Um, all of the parts are trying to help the person live a happy life, but in carrying these extreme emotions and burdens, they can actually end up getting in the person's way and actually hurting the person by mistake. So the goal overall is not to eliminate parts, but to help them unburden and be joyful again, and then work together with self. Um, I like this joke about the nesting doll, like there are small parts inside of us. Um, but if we move to the slide 4, we see this donut conceptualization of parts and self, in which the core self is in the middle, and the managers, these are different parts, and firefighters and exiles, the parts are all around the core self. We know we're coming from a place of self when we are displaying the qualities of the 8 C's, which is curiosity, compassion, creativity, courage, calm, and confidence. Um, when people are in the core self, they describe being centered. And the core self can and should lead the internal system. We also have the 5 P's. In IFS, there are lots of uh, things like this, little graphics and metaphors and 5 P's, 8 C's kind of thing. Um, so the core self is supposed to be the leader, working with the other parts. Um, but as I said earlier, when a person's young, we'll move on to the next slide, which is called exiles. Um, the exiles are parts that sort of splintered off when the person had trauma in their youth. These parts are stuck in the past. They have extreme emotions. They're very isolated, and they're desperate to be cared for and to be heard. The other parts try and hide away these basement children, as they're known as, because they can have such extreme emotions. It can be embarrassing for the person suddenly to display extreme emotions. Um, so on the next slide, we'll see that we have protectors. Managers and firefighters are both protectors who try to keep the exiles in the basement and keep them from emoting and having their emotions and their extreme burdens shown to the world. The protectors work in different ways depending on who they are. The managers are very controlling, or they can be caretakers of others, people who never put their own needs first and are always thinking about others. They're trying to run everyday life. They might tell you you're lazy, you need to do more. That's the managers are the part that tell you, you can't sit still and just enjoy something. You need to be doing things at all times, otherwise you're worthless. That's the sound of a manager internally, sort of beating you up. The firefighter extinguishes the feelings of the exiles generally, um, doing extreme things like substance abuse, binging, cutting, extreme sports. They'll come in and suddenly the person will be halfway through a bottle of whiskey, um, before they've had a moment to think about what they'd rather be doing. The firefighters come in to extinguish feelings.
When it comes to applying internal family systems therapy, we have to come from a perspective of inclusion and understanding the unique perspectives that our clients are bringing in. That comes across the entire spectrum of their identities, including their race, ethnicity, their spirituality, neurodiversity, and socioeconomic status, gender, sexual orientation. All of these things factor into the experience of therapy. And while internal family systems offers us an excellent framework for taking in these diverse perspectives and validating them in their experience, we still have to understand as counselors that the approach of internal family systems is going to feel different to different people based on their background. An example to share is at the beginning of the collaborative work All Together Us, which was written by Dick Schwartz, the developer of IFS, but had contributions from more than a dozen therapists across a wide variety of diverse backgrounds. In this book, they got contributions that spoke to the impact of IFS based on individual identities. And Fatima Finney is the author who introduced the section on intersectionality. She shared that her experience of IFS and her first exposure was not a positive one. And the reason was the portrayal of self energy, the portrayal of creativity, calm, collectedness, connectedness. All of those things did not necessarily feel achievable to a person who came from a background of marginalization and experience of systemic oppression. She posed three questions to the practitioners of IFS. She asked, how does one remain calm in the face of police brutality? Can a single mother working multiple jobs be expected to exhibit creativity and clarity? Lastly, she asks, is there a place for righteous anger within a people who have faced generational persecution? Now, the answer to these questions is not necessarily no, but we have to consider that this is the impact that concepts like the 8 C's of self led energy might have on someone if we don't show an understanding and an empathizing with their unique background and perspective. That being said, internal family systems offers value to individuals who have come from a trauma background, if they suffer from attachment injuries, if their issues with mental health are related to interpersonal roots. Internal family systems has so much to offer individuals from those perspectives because coming into contact with their parts and identifying their unique hurts is going to be an excellent path toward healing. In Altogether Us, the section on intersectionality offered a wide range of diverse perspectives that I've included here. And I'd like to talk through what Julia Sullivan shared about the impact as an Indigenous woman. She shared the importance of feeling a power with and not a power over dynamic in therapy. Her therapist did not take a position of authority or lead or guide her in their counseling, but instead left room for what she describes as a practice of waiting, holding silence, waiting, holding more silence, waiting, breathing, breathing some more, and finally having a deep calm to come over her. That's what was valuable to her. Regina Way is an Asian American marriage and family therapist who shared how her part's work was centered around generational healing. It wasn't enough for her to identify just her individual needs, but her path toward healing had to include taking care of her family members so that they're also healed. As she says, often with the help of my ancestors. Dr. Kim Balling shared the importance of recognizing neurodivergent individuals' unique identification and how their association with the label of neurodivergence, the label of autism, the label of ADHD, each of those plays into an individual's unique conception of themselves and how they fit into the picture of neurodiversity. Approaching a client like that with assumptions about what neurodiversity means to them and the impact it has on their lives could have a negative effect on the trust and the confidence that our clients have in our ability to see them and move forward through parts work in addressing their needs.
Okay, so just to be clear, um, everyone has parts, no matter which culture or color that we come from. And in some, in the view of some people of color, they need to have parts that mask them in order to be safe when they're in white society. For example, in IFS, that masking part is 100% welcome. We wouldn't ask the part to change itself or to do a different job. We would encourage the part to work with the self to keep the person safe. I want us to be very clear that IFS doesn't ever ask a person to be more calm or collected or courageous. We're doing the experiential practice of getting the person to be self-led. So we wanted to add a disclaimer here. IFS groups are usually closed groups. That's to allow for members to get the hang of using the IFS language and system of thinking, and not having new members just arrive without being able to understand what's going on. And we might do an individual exercise with Joe, at least, if not an individual session, before he comes into group. And we would do that before the second session, individually work with Joe on some parts, some psychoeducation, some consent for trying the modality and the way it works. And then the therapist prepares themselves before each group with a therapist self-exercise, which helps them be sure that they are in self. So the therapist's role is, in leading these groups, is facilitating intention setting, modeling and promoting speaking for their parts, doing direct access, facilitating unblending, and using reflective listening and facilitating U-turns in conversation with the group. And the therapist is also supporting people in learning how to be self-led and accountable for their parts. And the therapist is tracking individual and group sequencing. So now I'm going to speak to how we would run a session with Joe, session 2. As we said, we'd do the group agreements, confidentiality, and the inward looking of noticing self and parts and speaking on behalf of self and parts in group. And we're going to all agree to that. And then with Joe in the second session, bearing in mind that we have spent some time with him before session, we're going to do, after the group agreements, we're going to show a movie called Inside Out, in which the participants will see parts interacting. And then we're going to have them do an inward sort of meditation in which they write down which parts of themselves they noticed in the movie. And then we may have them either map out those parts and just speak about the parts that they saw, but in the context of the conversation with Joe and how the group went down the week before. So basically, we're going to do a structured activity to help participants speak about what came up for them the week before, including Joe, but using the introduction of the movie as a way to access that. And now I'm going to turn it over to Quinlan.
When it comes to managing Joe within our IFS group practice, there are a few best practices that we can utilize to make the most of our interactions. Bringing conflict into a group entails navigating around it and also making it productive at the same time. So we'll find that some of these strategies are oriented toward maintaining a safe environment in the group, and others are directed at transforming some of that negativity into something productive. And starting with this first highlighted group leadership skill, obtaining the permission for pausing and interrupting is really valuable in the process of setting up our agreements. Because for a client like Joe, he's coming in with a lot that he's ready to unload. And by having the understanding, first of all, that he may be interrupted, we'll avoid interrupting him and turning that frustration into anger. And also, just by setting that expectation, he knows that there's a certain amount of order that needs to be maintained in the group that we'll be introducing by facilitating with interruptions. Facilitating unblending implies that we are going to work with Joe toward not only becoming aware of the parts that are coming up for him, but also recognizing the self underlying those wounded parts. And once he's able to identify each of those, he'll be able to consciously separate and distinguish. And by recognizing that the angered and wounded part of himself is not his whole self, he will be on his way toward unblending those painful and, in this case, pretty harmful habits. Finally, working with participants' projection and transference applies pretty directly to Joe. All of his contributions in the session so far have consisted of angry outbursts that are pointed outward, and he has not done much inward reflection. So, whatever we can do to help him recognize projection, taking his insecurities and projecting them onto others, and then allowing his feelings toward others to guide his contributions to therapy, the transference process, raising his awareness to both of those is going to do a lot of work for him in recovery. In the process of researching our approach for Joe, we came across some peer reviewed research that does not pertain to internal family systems, but broadly to group counseling. And the first study that you'll see referenced here by Smith et al. In 2022 covered the impact of the big five personality traits on the outcomes for group psychotherapy. And to share what those five personality traits are, we're including openness, conscientiousness, extroversion, agreeableness, and neuroticism. And the study essentially looked at how these qualities in group members impacted the outcomes for therapy based on whether they still experienced depression, both immediately following therapy and 6 months after. And what they found was that those personality traits, whether negative or positive, were not correlated with any particular outcome. So that gave us confidence that bringing Joe into session was not necessarily a threat to the outcomes for therapy for the rest of the group. The second study here from Mitchell and Mitchell is an older study from 1984, but it represents an approach to group counseling that frames conflict in a way that's constructive by identifying behaviors. Typically, in conflict and group counseling, negativity is introduced in an indirect way. Negativity isn't often being brought in a mature, problem-solving, critical way, but rather in an insecure and a rather projecting way. And so, what's proposed in Mitchell and Mitchell's writing on conflict and group counseling is that what we can do as facilitators is start to transform that negativity into direct communication, transform the accusations into feeling statements. And something that gets facilitated through internal family systems interventions is pushing our clients to recognize what their parts are feeling. And this is intrinsically a form of self-ownership and a form of directness that is going to give our clients a lot more value than displacing their issues onto others.
One thing that we both spoke about as therapists doing these sessions with someone like Joe is that we would be very agile. We would be listening. We would be seeing what resonated with him and how much he could grasp the concepts and go with them. And we would tailor our therapy sessions to everyone but specifically in the second one to Joe and Kyle and Anna, to ensure that they had a pleasant second session and were able to process and resolve the upset from the first session.